Each year, Microsoft Research hosts hundreds of influential speakers from around the world, including leading scientists, renowned experts in technology, book authors, and leading academics, and makes videos of these lectures freely available.
Next up, we have Carnegie Mellon University with Gatherwell, Creating Shared Knowledge.
Hi, I'm Jane, and this is Lorraine and David. We're from Carnegie Mellon University, and we're here to share a concept called Gatherwell. I'd like to introduce you to Laura. So Laura was admitted to the hospital for pneumonia just a few days ago. Unfortunately, her experience there was overwhelming. She mainly worked with Dr. Lee, but she also came in contact with a number of other medical professionals. Her husband, Nathan, tries to visit as often as he can, but he also has to take care of their baby at their home. On top of managing communications with her doctors and her family, she also has a ton of information given to her, from test results to home care instructions. So Laura is having to deal with all this, and it's really overwhelming already. But imagine if, sorry. Oh, yeah, so yeah, she's not alone. It's really not uncommon to have this experience. And in our early research stages, we came across one patient who we talked with, and she had 18 different medical care providers in just one hospital stay. Another patient told us about how she had a surgeon and a physical therapist give her conflicting information, and she left just not knowing what to do. And this is not an uncommon experience. In the midst of all this, you can imagine how much more difficult it might be if Laura was deaf. And she's not alone in this. In one study, 41% of deaf patients left their health appointment feeling confused about their medical appointment. And this is a really critical moment when they leave, because if they're not understanding their treatment, their illness, then it can really lead to readmissions unnecessarily. And hospitals want to prevent readmissions because of exponential costs. So we wanted to learn more about healthcare and the field of communication. In order to do so, we first interviewed 26 individuals, from patients to nurses and social workers, academic researchers, as well as designers in the field of healthcare. We also conducted workshops such as role-playing and card sorting. We observed nurses and social workers in the hospitals. And we also did usability tests through experience prototyping and rapid concept testing in 2 senior living communities and a medical center's innovation center. So this is a photo from one of the experience prototyping sessions where we had a participant pretend to be a deaf patient interacting with a doctor, and we had real-time transcription happening. And here's a clip from that session.
Do you have any questions about what an ACE inhibitor is?
It's really great to see it on the wall. My family doctor was telling me I might have to go on ACE inhibitors, but that's all he said. He never explained it.
Okay.
So if you could explain it a little further, that'd be great.
Yeah.
So what this experience prototyping really taught us, as well as some of the other research, is that a lot of the interactions we want are possible today. But what we want to do is think about how we can push this idea further and think about the future. So we decided to design an ecosystem of multiple technologies that can really create the seamless experience. And now Lorraine will talk more about our key interactions and insights.
So, hello? Okay, after spending much time going through our research, meeting and interviewing with these people, we consolidated our research into 3 key insights. So one of them is that discharge information is often very cryptic and lengthy because it is a process that involves many procedures and conversations. And discharge papers that aim to consolidate all of this into a single piece of paper or several pages of paper may not ensure that the patients are ready to leave the hospital. So in response to that, Gatherwell summarizes and captures each conversation that happens with tagging and visualization, so that instead of having to sift through pages of paper, you can easily extract key information very quickly. And secondly, we learned that medical interaction is a group experience that involves many, many stakeholders, and they have to be on the same page. So in response to that, Gatherwell also offers remote virtual conversation where stakeholders can join medical conversations anytime, regardless of location. And lastly, we learned that hearing disabilities create major communication barriers, communicating medical information, delivering them and receiving them. When we were talking to a deaf interviewee, she revealed us that deaf patients oftentimes at hospital, they're very, very reliant on in-hospital translators with very limited independence. So in response to that, Gatherwell offers real-time live translation and transcription of American Sign Language so that they can be independent and depend less on human assistance. And also, the service offers both translation and transcription in ASL and text, American Sign Language, because it revealed us, through research, we learned that deaf community, the members of it, sometimes may prefer one or the other, as ASL is considered a separate language from English. So here is a video that demonstrates the concept.
So we're really excited about what this combination of technologies can provide. It's not just a simple translation service, but a combination of multiple technologies. So for a conversation between a patient and the doctor, we're using augmented reality glasses to give that live translation. For caregivers, in this case, the husband can also join the conversation through remote access. And then also, all of the stakeholders can be involved through the transcription and the summary capabilities so that they can review those conversations at a later time. And it's also interesting because this technology can also span across a spectrum of other types of people, not just those in the deaf community. For example, somebody who is temporarily disabled, like say somebody is waking up from anesthesia, they could use this, especially the transcription abilities, to review the conversations that happen. Also, somebody that may be situationally disabled, like somebody in a foreign country, could use this for the live translation capabilities, as well as the remote access, because they could invite their doctor at home to join the conversation. And then beyond that, just really any patient can use this technology to kind of bring everyone to the table and be on the same page on the patient's journey to wellness. Thank you.
Thank you, CMU. Who would like to start?
Well, great job, guys. I also saw this on Monday, so it's come a long way, and you've done a great job answering some of the questions and clarifying some of the points that you've obviously done a great deal of work on I'm a big fan of the, sort of the transcribing, collecting, and representing back to patients, what is the recommended course of action, the next steps, how to get to your next appointment, follow-ups, all of the kind of cryptic stuff that, and even a service that did that part alone would be, a huge step forward for a lot of people, because I'm sure we're all disabled to some degree cognitively by post-illness, just trying to sort of remember what the course of actions are. I feel like this may be a project that sort of suffers from like one too many ideas a little bit, and the augmented reality translation layer where the caregiver is essentially, there's a superimposition on her doing an animation of the actual sign language. So she prefers the sign language than just the text in this scenario. I feel like whilst that probably will happen at some point in the future, it's I think probably a fairly distant moment, and I'm not sure the sort of lift is worth the benefit right now. And there's sort of some issues there around what if she was gesturing in something important gesturally, and how would the sign language interpret that was not, something that it didn't need to sort of take over or sort of crush, if you know what I mean. Mm-hmm. So I had some questions around that aspect of it, but overall I think it's a very, very commendable effort that would have a wide variety of potential beneficiaries. So congratulations.
I wish I could be a little bit more helpful. I mean, I think from the aesthetic here, it's this is obviously very useful technology. I love the clean design. I mean, it feels like a special purpose sort of Skype in design, and so that's really, really attractive and seemingly very functional. I mean, I think to your points, there is probably quite a bit of complexity in there. You wouldn't really know exactly how well this works unless you were kind of in the dynamic, and so I'm kind of lacking that perspective. But elegant from your presentation. So, congrats. Seems like a lot of hard work.
Yeah, very nice. I agree. I think with Rob. I mean, I think it's really nice, but maybe a bit overly complicated, and maybe taking like one part of that would have been, easier to both express that idea in a short time, but also kind of easier to engage us, your audience, I think, in kind of really, like, what was going on in that AR video? I was like completely confused. I think also, but you do have this like really great idea here about, the importance. Nobody understands, no one can remember anything the doctor said as soon as they go outside the door. It's a well-known phenomenon that it's completely like, no matter how much, that's why they say take a friend and take notes, and you both sat there completely befuddled and then leave and have no idea what they said. So, there's that importance of conveying that information. There's the being both deaf or not actually being in a foreign country, being in your own country and speaking another language can be a huge barrier, because you have to wait around in pain till someone comes who can explain in a language you can understand what's going on is terribly traumatic for people. So, so I think that would be brilliant. So I think really focusing on what's core there is that really actually, how do you explain stuff to people and so that they can remember it? I think that's really powerful and well worth exploring more.
We have time for one question from the audience. No questions? Okay, so thank you so much, CMU.
Each year, Microsoft Research hosts hundreds of influential speakers from around the world, including leading scientists, renowned experts in technology, book authors, and leading academics, and makes videos of these lectures freely available.